Hi, I'm Nina Clark-Christoph, and I'm here today with my colleagues to talk with you about Daxxify. We're so excited to have it in the practice. We feel like we're an elite office. Only 1% of the offices in the country are able to get this product yet. We're part of their preview program that they're offering. So I think we've all been injected with it, as well as treating our own clients. We brought it into the practice because we've had such great experience with their filler collection, the RHA. That means resilient hyaluronic acid. And that was really a paradigm change for us with fillers. It's super stretchy and soft. It moves. It's the first FDA-approved collection of fillers for dynamic muscle function. So we're excited to have Daxxify. We feel great about the science behind it. I believe Melissa's going to discuss that further with us. But they've been studying it for 20 years, first looking to use it as a topical neuromodulator, and now looking at it for injectables. And we still love all of our other injectable neuromodulators, but this just gives everybody another choice to have. So
That's nice. Yeah. I like the convenience of it. I like the idea that you can get injected maybe just twice a year versus 3 times a year, so you can maintain that correction. I also love the amount of lift that I've gotten with it. I'm one of those candidates that cannot treat my forehead because in doing so, I'll drop my brow a bit, and I want all the elevation that I can get. So I feel like I've gotten the benefit of both a smoother forehead with more brow elevation. And then the idea that I can do that just twice a year is a real winner for me.
Yeah. And I was going to say too, a lot of times people are wondering, am I a good candidate for Daxxify? And really you are, if you are a candidate for any of our other neuromodulators. If you have lines in between your brow that are bothering you, then those would be, you would be a great candidate for Daxxify. The other thing that I wanted to mention was that we have our fillers that you do with RHA and our other fillers as well that you can have and get a good duration out of. So you can kind of match up your Daxxify treatment with your filler treatment, then not having to come in quite as often, which is nice. And I think a lot of patients can appreciate that.
I agree. And I have to say, Andrea, and I think we all agree, the lift has been something, and when we were at conference, Nina, they said something about Daxxify, it's just different. It's a different experience. And that's what we're finding with patients. But the science behind it is going to be similar to the other neuromodulators. The difference is in the peptide complex. So what happens is there's a protein that's around your neuromodulator, and the other ones are made of different proteins, but the peptide complex on the Daxxify, it allows it to stay more stable on the neuromuscular junction where it binds, and so the frown lines are reduced for a longer duration. So not to bore you with details, but it's something significant. I mean, we've never seen anything like this before.
I think one way that it was explained to me that I think anybody could appreciate is that it's a more efficient protein.
It is.
Which means that you're getting more coverage.
Right,
Because
exactly.
it is more efficient.
And visibly we're seeing that too.
Right.
It's migrating.
another good descriptor that I was told is think of it almost like Velcro or a magnet. It's really going to bind because it's so highly electrically charged. It binds to that neuron, so we get much better uptake of the neuromodulator core protein.
And I think 2 days, I mean, everybody responds differently to the neuromodulator, but I mean, I think we're all finding that this one specifically, Daxxify specifically, is kicking in sooner versus the other neuromodulators. So I think mine personally was like 3 days in, and I had a nice medial lift, like between the brows. Like Andrea stated, usually, you know, you wouldn't get as much lift in this area, but it's been quite quick.
Yeah.
You know,
Yes.
so.
I've seen some people in 24 hours, they are 50% of the way there.
Yeah, agreed.
Yes, all very happy with their
exciting
treatments.
Right. Can y'all ladies think of anything else to chat about?
I like Megan's point about using it twice a year from the convenience perspective. And economically, it ends up being more cost effective if you can schedule it that way. So sometimes if you can correlate it with your filler, if one gets dermal filler, twice a year would be ideal in some cases. So
Right, particularly our clients who travel a great distance to see us, or perhaps our clients that are on blood thinners. There's always a risk that you could have a bruise. So I think those people would be
Yes.
really excited about it.
agreed.
Lessen the amount of treatments.
Yeah. No, we're excited
right.
about it.
We're thrilled to have Daxxify. It's another tool in our toolbox to help you out with your aesthetic goals. If you have any questions, all of us can help answer them. Just ask for your regular provider, and we'll let you know if we think that's a great choice for you. Have a great day.
Thank
Bye.
you. Bye bye.